Hi, my name is Bianca Brunauer. I am going to talk about Isoniazid preventive therapy in HIV-infected pregnant and postpartum women. Definition: tuberculosis is the leading cause of health and death among persons with HIV infection who reside in low-income and middle-income countries with high tuberculosis burden. Among women, tuberculosis predominantly affects those of reproductive age. When tuberculosis develops during pregnancy or the early postpartum period, it is associated with adverse maternal, pregnancy, and infant outcomes.
HIV in pregnancy. Will HIV hurt my pregnancy?
No, HIV does not directly affect pregnancy, but although it doesn't directly affect it, it is possible for a mother to pass the virus during pregnancy, labor, and delivery, or through breastfeeding. This is called mother-to-child transmission. The smaller the amount of the virus in the mother's blood, the smaller the chance is of passing HIV to the baby. Antiretroviral therapy, often called ART, is the medicine prescribed to people living with HIV. ART lowers the amount of virus that is in the blood. Taking ART as prescribed will greatly lower the chance of HIV being passed to the baby.
Will my pregnancy make my HIV worse?
No, pregnancy does not make HIV progress faster or get worse. However, to avoid transmitting the virus to the baby, it is important for a pregnant woman living with HIV to seek prenatal care and begin antiretroviral therapy to avoid transmitting the virus to the baby.
Does the HIV medicine, ART, hurt my baby?
It is important to see a doctor who is knowledgeable about HIV treatment during pregnancy. An informed doctor will know the medicines that are safely prescribed for pregnant women living with HIV. This will ensure that the pregnant woman and her baby get the best care possible. There is some evidence that the use of ART can increase the chance of preterm birth. It is important for the healthcare provider to be aware of this potential complication in order to monitor a woman's pregnancy.
Will my baby get HIV?
HIV can be passed from a mother to her baby during pregnancy as well as during and after delivery. However, there are things that can be done to prevent the baby from being infected. Your baby has the best chance of being born uninfected if you take HIV medicine as prescribed throughout your pregnancy. To stay healthy and to have a healthy pregnancy, it is also important for you to find a good doctor and get regular prenatal care. Eat nutritious food. Get plenty of rest. Get support from your family and friends. If you are using drugs or smoke, try to stop or cut down.
If my baby gets HIV, will she or he die?
With proper prenatal care and HIV treatment, the chance of a pregnant woman passing HIV to her baby is very low. If the baby is diagnosed with HIV, it does not mean he or she will die. If the baby is diagnosed with HIV, it is important for the baby to see an infectious diseases specialist regularly for treatment and to maintain good health.
Applications in medicine. In this multicenter double-blind placebo-controlled non-inferiority trial, we randomized assay pregnant women with HIV infection to receive isoniazid preventive therapy for 28 weeks, initial either during pregnancy or at week 12 after delivery.
One of the emerging themes that have come out in the last year and has been very strongly articulated in CROI this year is the need to get data, efficacy and safety data in pregnant women, and to have it in a timely manner. And this has been a long-standing problem that women are viewed as a vulnerable group and end up being a neglected population in terms of getting the requisite evidence to treat safely and effectively. So we have shown that in a certain group of women at high risk of transmission, that dolutegravir could potentially reduce the viral load much faster than current standard of care. Now, over the last year, dolutegravir has had a bit of a mixed press. It's certainly a very effective drug. It's certainly been rolled out across the globe. But there have been some alerts around the potential for birth defects, neural tube defects, although these are yet unconfirmed and preliminary. However, the response to this concern has very understandably been heightened by the report, and so different countries have implemented different things. There are countries who say we can use dolutegravir freely in pregnancy outside of the first trimester, which is when all the risk of neural tube defects is, ranging right across the countries which have said no dolutegravir to any woman of childbearing age whatsoever. So I think we are arguing for a much more appropriate, stratified, risk-based approach to taking dolutegravir. And in the third trimester, where the organs have already formed, there is very little risk of congenital malformation and a lot of benefit potentially from the rapid viral load reduction.
Pros and cons. Pros. Isoniazid is addition of ART is strongly recommended for the prevention of tuberculosis in patients with HIV infection. Cons. The safety and efficacy data are lacking regarding isoniazid preventive therapy in pregnant women who are receiving antiretroviral therapy, because pregnant women have been consistently excluded from trial of isoniazid preventive therapy.
Antiretroviral medications are used to prevent the perinatal transmission of HIV from an infected mother to her baby. But this benefit needs to be weighed against the potential toxicity and adverse pregnancy outcomes associated with combination antiretroviral therapy. The PROMISE trial enrolled 3,529 women in the second trimester of pregnancy who had asymptomatic HIV infection with a CD4 count of 350 or more and randomized them to one of three groups. The zidovudine alone group received zidovudine during pregnancy, a single dose of nevirapine intrapartum, and tenofovir emtricitabine postpartum. The zidovudine ART group received combination zidovudine, lamivudine, lopinavir, ritonavir during pregnancy and postpartum. And the tenofovir ART group received combination tenofovir, emtricitabine, lopinavir, ritonavir during pregnancy and postpartum. Rates of discontinuation due to toxicity were low across all groups. The primary outcome was the percentage of neonatal HIV infections, measured 1 week postpartum. An interim analysis of the study demonstrated that the rate of early transmission of HIV was 1.8% in the zidovudine alone group, as compared with 0.5% in the combined zidovudine ART group and 0.6% in the tenofovir ART group, both significantly lower than in the zidovudine alone group. However, the zidovudine ART and tenofovir ART groups had higher rates of maternal chemical abnormalities than the zidovudine alone group. Zidovudine ART and tenofovir ART were also associated with more adverse pregnancy outcomes, such as low birth weight and preterm delivery. The authors conclude that combination antenatal ART resulted in significantly lower early HIV transmission than zidovudine alone, but at higher risk of adverse maternal and neonatal outcomes. Full trial results are available at nejm.org.
Issues apply in Ecuador. In Ecuador, the Ministerio de Salud Pública, or MCP, has arranged for the diagnosis of HIV infection in pregnant women in all public sector health units that have a laboratory and in some self-employees. All pregnant women with a cold last